You're wearing a nice shirt. Somehow I'm not able to hear you.
Yeah.
Yeah.
So
Yeah. Now
I
it's
think
okay.
we
Yeah.
Khan Sahab have joined kya?
I think I have.
There he is.
Okay.
Okay, right. I got it. You are able to hear my voice?
We can hear you
Yes.
very well.
Okay.
Hear you very well. So, Khan Sahab, when you are going to present, then you will get the right to do screen sharing. ये पहले म्यूट है, स्टॉप वीडियो है, उसके बाद शेयर आएगा, शेयर कंटेंट. अभी तो not active है. When your name is announced, you will get that, and then you can share your screen. Okay, you know how to do screen sharing, no?
Yeah, I know.
Very good. So just follow the steps. If you have any problem, then we will solve it quickly. Yeah.
Maybe you can tell me because I haven't used WebEx as yet.
Okay. So
share and
right
yeah.
now the audio mute, stop video, start video is there, and then in a gray color you have that share content. Gray color, you see it as a third one. Now it is not active for you.
Content. Yes, that's true. Share content.
Now it is not active for you, but when your name is announced, you will see the icon change. Then you click on that, and then it will open up the screen with your file there. So you will have to see which is your PowerPoint and show it. Click on the
got it.
slideshow mode. Yeah. Cool. Yeah.
Sure.
Okay. Can you hear Shivani? Can you put your camera on?
Yes.
Now we can see you.
Can you see me?
Yes, we can see you.
Okay, I hope I am audible enough. Voice is okay.
Very audible. Very audible. Good.
Okay, that's wonderful.
Thank you.
Thank you.
And
I already heard you saying how to share and all those things. So
Good afternoon, madam.
Good. Absolutely. Yeah. Ranjan is the one who is the NIDM coordinator for the webinar.
Good afternoon.
And then there is
Good afternoon, sir.
Good afternoon, Ranjan ji. Good afternoon, Ranjan ji. Yeah. Kumar ji aayenge na? Dr. Kumar Raka will be the one to inaugurate, no?
Sure. Thanks, Ray.
Sure. You're all.
Good afternoon, madam. And So, sir, start करें अगर आ गया तो दे दो. Reconciliation, sir. We can start. Raka, sir.
हाँ रंजन जी 3 बज
Please.
गए हैं तो धीरे धीरे स्टार्ट.
Yes, please. Yeah. Let's start.
Sir, so very good afternoon to everybody. Welcome here for today webinar. आज का जो वेबिनार है बैकग्राउंड सम डिस्टर्बिंग आ रहा है. ओके सर, फर्स्ट ऑफ ऑल आई फॉर्मली वेलकम टू ईडी NIDM जिन्होंने इस तरह के वेबिनार को आयोजित करने के लिए हमको किया. वॉइस इज क्लियर सर?
हाँ कंप्लीटली क्लियर. गो अहेड.
I also welcome to our project director, Professor Santosh Kumar, project officer and head, Dr. Kumar Raka, and my colleagues, Dr. Vasu, तो इन्होंने इस तरह के प्रोग्राम को, इस वेबिनार को आयोजित करने के लिए सपोर्ट प्रदान किया और अपना किया ऑन द बिहाफ ऑफ NIDM। मैं सभी स्पीकर्स पार्टिसिपेंट आज उपस्थित है इस वेबिनार में, मैं उनको स्वागत करता हूं। और आज इस वेबिनार का मेन टॉपिक जो है इम्पोर्टेंस ऑफ वाटर सैनिटेशन एंड रिस्पॉन्स टू कोविड-19। जो अभी जो अनप्रेसिडेंटेड सिचुएशन जो कोविड-19 का है, इस सिचुएशन में इसका रिलेवेंसी जो है, इसका जो इम्पोर्टेंस बहुत ज़्यादा है। और इस कोविड-19 के खतरे से बचने के लिए जो हमारे गवर्नमेंट ने मिशन चलाया है, जन आंदोलन जो चलाया है कि कोविड-19 से जो खतरे हैं हमारे पूरे लोगों को, या तो मरीज हो या बच्चे हो, तो इसको ध्यान में रख के, इस कंटेक्स्ट को ध्यान में रख के जो आज का जो वेबिनार है बहुत इम्पोर्टेंट है। और इसके लिए CTRR सेंटर जो कि विगत 6 मंथ के इस कोविड-19 से रिलेटेड बहुत से वेबिनार आयोजित करते आया है और आगे भी आयोजित करेगा, जिससे कि लोगों को फायदा मिले। वंस अगेन ऑन द बिहाफ ऑफ NIDM, मैं डॉक्टर कुमार को आज के इस वेबिनार पर कुछ अपना जो विचार है व्यक्त करने के लिए अनुमति स्वागत करता हूँ।
Thank you, Ranjay. Thanks a lot. Good afternoon to all the participants here. Ranjan, I would request you to go and now take care of the hosting, actually, because a lot of disturbances are also coming. So you can go to the host computer and check it out. A very good afternoon to all of you participants here. This is our next important webinar, and today's webinar is focused on WAS. Actually, we all know that water sanitation and hygiene is one of the very key component of our health protection. And not only during COVID-19, but also before COVID-19, WAS components in our daily hygienic situation and health conditions were playing a very, very important role. And during this pandemic, we have observed that one of the very important component is hand washing. Hand washing is why there are reasons behind it, there is a logic behind it, and hand washing is with what and how long. Actually, everything has a logic behind it, and so is the hand washing. And hand washing, let me tell you, is one of the very, very, very important component if you want to break the chain of COVID-19. And when we are talking about today's WAS, and that is the topic is importance of water and water sanitation and hygienic response to COVID-19 situation, then actually it becomes one of the prime importance, one of the things of prime importance, how we are going to break the chain and how we are going to keep ourselves safe, our children safe, our family safe. And when we are talking about water sanitation and hygiene, then we also have to think about a number of things. It's not only about individual WAS campaign or something like that. The schools are going to reopen, and when schools are reopening, then water sanitation and hygiene is very, very important there. Hand washing is very important there, and how the kids will be actually trained to manage that, to do that, it's another very important concern. And actually school is one part. When we are visiting marketplace or something like that, the situation is now completely different. Before COVID-19, the situation was something else, and this is a new normal where hand washing and hygienic conditions has been the key essence of breaking this chain. So what facilities we are having in our marketplace, within our school, within our health infrastructure, even if we are visiting any clinic or hospital, then also the water and sanitation and hygiene is very, very, very important. We have today a number of very eminent speakers with us. Prasad Bhagwan Sevakari ji, who has been decades of experience in this field, WAS field and disaster management, and he is a very senior fellow who will be discussing all these things with us. And also we have one UNICEF consultant with us, Mohammad Samsuddin Khan, who has a lot of ground experience and has dealt with WAS initiatives before COVID-19 also. And during this pandemic situation, this biological disaster, how much importance WAS actually plays in our life is will be really very interesting to understand. And the next important eminent speaker is Ms. Sivani Rana from Change Alliance. She is also with us today. And on behalf of National Institute of Disaster Management, I would heartily welcome all the eminent speakers today on this platform. And also, like Ranjan told, that Executive Director NIDM has been always a prompting force behind all these initiatives which we are taking on behalf of Government of India, National Institute of Disaster Management, and reaching out to the masses every weekend and weekdays, discussing a number of themes and topics relevant to children and how we can fight with COVID-19 is really a great effort from our side, our humble effort actually from our side. So I also heartily thanks my Executive Director Manoj Kumar Bindal and Professor Santosh Kumar also, who has always been a guiding force for all of us. This webinar will be, before starting it will be Beimani if I don't mention Sri Ray Kachrela, who is also a senior advisor and consultant, humanitarian and DRR and climate resilience expert. So Kachrela sir has been the brain behind this works of this project, today's webinar, and I'm very thankful to serve you on this platform. And on behalf of National Institute of Disaster Management, I extend my gratitude towards you. And Ranjanji, thank you very much. Along with that, I think that it won't be good to take a lot of time, and we have three very eminent speakers who are going to speak with us with the protocols, themes, the processes, and their ground level experiences, and what can be done in the future during this COVID-19, specifically in this area of water, sanitation, hygiene, and waste management. So let's start with that, and I'll hand over to you, Ranjini. You can invite Ray Kachrela sir if he wants to say a few words about this webinar, and after that we can proceed. Thank you very much.
Now I request to Ray Kachrela sir for say some few words regarding to webinars.
Thank you very much, and thank you, Dr. Rakaji, and thank you, NIDM officials, Executive Director Shri Manoj Kumar Bindal, and also Professor Santosh ji, and all the other staff, and Mr. Ranjan, who has been coordinating this. So it's a great honor to be working with the National Institute of Disaster Management in such vital areas that are impacting our human lives. So if we say in 2 or 3 words, the vision of any humanitarian action is basically saving and protecting lives. Saving and protecting lives. In fact, last week I was in Vijayawada in the district of Krishna, where we had a very intense flood in a very small area. And the first thing that we could recognize is the need for water, sanitation, hygiene. Now, in the primary impact, we lose lives, but for lack of wash, we lose secondary, level lives. And that is going to cause disease burden, etc. So it goes without saying the importance of this. So for today, we have some very, very eminent and very sharp speakers who have dedicated their lives to this cause. So I would now, without losing any time, I don't want to be between you and the presenters who are bringing their wealth of knowledge, experience, and understanding. And I'm sure they are going to inspire all of us. So I would like to request Prasad Sevakari ji. He has been a very dear friend for many years. We have worked together for South Asia framework for the care, protection, and participation of children in disasters. And he has a very strong global experience in managing what we call the WASH cluster in different countries and continents. So we cannot have anyone better than him to present this issue for us. So over to you, Prasad Sevekaraji. You will have the screen sharing right, and so please look for it. And please put up your presentation and lead us through your experience. Over to you, Prasad Sevekaraji.
Sure, thank you. Thank you, first of all, to NIDM, Professor Santosh, Major General Bindal, Dr. Raka, and my great friend Ray for inviting me for this very that is going to be discussed now. I wouldn't waste much time in talking about what really is the WASH focus, or what really is the essence of WASH, particularly because a lot has been already said about the significance of what it comes to emergencies, different types of emergencies, including COVID. As has been talked about, the significance of hand washing within the COVID, I would just like to say that WASH is important. WASH is important not just in COVID, but even before and even after the COVID pandemic. God knows whenever it would be over, but even after it would be important. Well, I hope that I'm audible to all of you. I'll go ahead with my presentation for the next, let's say, half an hour, and then we'll open the floor for question and answers, if any. So I was told about the focus of this WASH presentation needs to be on reopening of schools, and I'm hearing, and I'm glad to hear that in Andhra Pradesh, the government has declared that the schools would be reopening right next Monday. So this is something like an opportune event that is happening over here to see as to how the WASH, water sanitation hygiene response would be or needs to be organized when it comes to getting all the children back to the schools and tackling COVID. I'll use yet another word in mitigating the impact or consequences of COVID, because we are not yet able to tackle, we are not yet able to negate the impact of COVID, but what we are focusing on is mitigating the impact of COVID. And let's see how we fare with this. So this is what you see on the screen is the statistics of today. The COVID-19 cases in India have become more than 8.1 million, whereas it's 5 times what it is globally. So 20% of the global cases are there in India as of today. But what is more important is that how this has affected education. And I'm directly getting into the topic of education and COVID-19, given the very basic fact that education is a fundamental human right, and not just that, but it is something which is an enabler that has a direct everything else that comes is as well. So is the story of education, how has it been as is being said, COVID-19, no other emergency students trade disruption in the systems. What has it led us to? Well, I mean, we are talking about the schools reopening. We are talking about how and why the schools need to be reopened. Just to give you a few facts which might be able to convince you about why the need is so. In India, there are midday meals that are considered to be somewhat inviting or enticing children to attend the schools. These are considered as essential services. These are disrupted. Well, and this is just one of them. Risk of violence against girls seems to have increased. The school closures have not only exacerbated the chronic educational inequalities, but also reduced opportunities for many of the most vulnerable school-going children, which includes girls, children, students with disabilities, from the learning processes. This is what the Human Rights Watch has already told us. However, as you see in the photograph, there are so many students, so many young boys and girls finding new ways out to learn on their mobiles. But think of it as to how many of those have these smartphones. We are trying to be smarter, but not everyone has those smartphones or the devices which would allow them access to education. Innovation is happening. Innovation has been stimulated, but is there any continuity in this? And I do hope that the schools reopening from Monday onwards, day after, in Andhra, would have taken all this into account. That is also because allowing students to complete their studies and continue to the next level is absolutely important to keep their morale and psyche in top form. Well, this is also important for the social and psychological well-being of the students, of the parents, of the teachers, and all those who are dependent on the school ecosystem. If we reopen the schools, it's benefit to the society as well. I would like to tell you that we need to consider that there are increased vulnerabilities and risks for school children when we are thinking of reopening the schools. And I'm sure that the governments, the central and the state, they've both thought about it. Not that the decision has been just taken out of the blue. But these vulnerabilities, when it comes to whether the children are less vulnerable to COVID, well, the figures, the data, the researchers do not indicate that the children are more vulnerable. But think of it that it is not just the children that are there in the school environment or the school ecosystem. As I said earlier, there are teachers, there are non-teaching staff, there are those who transport children from their homes to the school, and back. There are those who are helping the non-teaching staff with keeping the school environment clean. All those, they are involved. So this might lead towards increasing the vulnerability of the children who particularly have some or other kind of comorbidities, which hitherto have not been mapped in the schools. There is a skepticism that whether the schools can become the breeding grounds for infection in these cases, particularly given the fact that the wash systems are non-functioning, abysmal in some countries around the world as well. Just to tell you, I mean, this is not unfounded fear. In Israel, in the month of June, when the school started, and when the survey was done later, a month later, it was found that the schools themselves were the second highest places for infection. The students did become infected, did get infected. And this was what had happened. Think of it that there was a warning that was issued by the CDC, the Center for Disease Control and Prevention from the USA, that full-sized in-person classes and activities and events are likely to spread or lead to the spread of COVID-19 in the schools. So this is a very bitter warning. And on the backdrop of this warning, we are thinking about and starting and initiating the work towards reopening schools. That's why it becomes all the more challenging as to what is it that is in store for us. But just to, again, take you to the basic considerations which the World Health Organization has prescribed at three different levels, I would say. It's policy, community, and school. So what is it that these different stakeholders would be doing when it comes to reopening? First of all, it's about resources. It's about infrastructure, or resources for infrastructure, which would help in protecting the health and safety of all the school stakeholders, particularly the children who we are thinking are more vulnerable. It's about putting in place all the policy procedures to ensure that we have adequate funds and we have the infrastructure ready to cater to the functional infrastructure, which is ready to cater to the needs of the children who are going to visit the schools after a long gap. Well, the school has responsibilities as well. We keep on talking about behavioral change, keep on talking about hand washing, which is now an agreed and accepted practice, which is followed world over and also in India, as was evident from different surveys. But beyond the hand hygiene, there is also a thing about respiratory hygiene that needs to be looked into when it comes to COVID or tackling the issues related to COVID. The behavioral change is not something that can happen just at the turn of the key. It's a gradual process. The school has a responsibility to ensure that the behavioral change processes are adequately pursued, adequately followed, to an extent that all the children not only wash their hands after 5 different incidents that they are supposed to, but also wear the mask, protect themselves, and dispose of the mask or anything else that is related remotely to their respiratory habits. That's what the school needs to be also looking into. How this has been done in India, well, we can talk about it in the other presentation, or we can get to know about it from the other presenters as well. But apart from the policy makers and the schools, there's also a responsibility on community, which needs to share, participate in the early detection, testing, and contact tracing of the COVID cases so that the children would be protected. And one thing that I've added is that the community has a great responsibility to ensure that the rumors, which are absolutely misleading, need to be addressed right at the root. So if these are the 3 different stakeholders at 3 different levels that need to be looking particularly into the 3 different aspects of the reopening of the schools, I think only then we would be able to progress. And then it comes to the brass tacks. So what is it that needs to be done at the ground level? It's about the seating arrangements, as we have been listening to from the Prime Minister or from the other concerned channels as well. 2 gaz ki duri, that's about 6 feet of distance, 6 feet of physical distance, which is minimum between the 2 persons. Now think of it, whether across the India and particularly in the remote places, if we have an enough space to allow a distance of 6 feet, I won't say radius or diameter, but a distance of 6 feet within the 2 students, how then we are going to accommodate all these students to ensure that the respiratory hygiene or the distance hygiene is also maintained. Staggered school timings is also being thought, and I have heard in Andhra, the schools would be, or the classes would be held on every alternate day. Correct me if I'm wrong, but the classes would be held on alternate days so that the schools would be able to accommodate the number of students within the school premises, which is a very good thing. As I said about the hand and respiratory hygiene, there is equally important issue of environmental sanitation, which needs to be taken into consideration over here. The basic fact is about the functionality and the adequacy, the functionality and the adequacy of the water and sanitation systems within the schools. And this is a global issue. It's not just about India. This is a global issue. Apart from having the adequate number of appropriately functional toilets and water points in the schools, it is also important that the schools have a clean environment. The school is clean, the rubble or the garbage that is collected is disposed of in a safe and hygienic manner. So it's not just the hygiene practices are not just about the respiratory and hand hygiene, or the wash is not just limited to hand washing. It goes beyond the school and the school within the school premises as well. And then we have to follow the screening procedures and ensure also that the high-risk individuals or the high-risk students who have certain kind of comorbidities or pre-existing medical considerations are mapped, segregated, and treated properly as well. The tasks are too many, and well, I mean, it needs to be seen as to how we approach them. But to ensure that the schools do function after a gap of 7 months, do function seamlessly or smoothly, we have to start with a few things. Making soap and water available, ensuring that the water is also potable, ensuring that the toilets are clean and available, as I said already. But to ensure that the toilets are clean, it also means that we need to have the non-teaching staff, which is involved in cleaning, in an adequate number as well, and in a healthy condition. collecting the solid waste and disposing it off, and keeping the school campus clean. This I'm repeating because this is also important, is necessary. But one thing which the World Health Organization advocates is disinfection of teaching and learning material. Think of it as to how much of sanitizer would be required, or how much of hydroxy, or how much of sodium hypochlorite would be required to clean. But it is necessary, as what the WHO is advocating. As we go ahead, we need to think about the way in which the school facilitates the hygiene education to its students. There have been attempts that the hygiene or wash-related education be incorporated within the school curriculum. In India, it has been done in most of the schools, I would say. But still, there are issues related to, let's say, if it's about respiratory hygiene in terms of COVID, there are issues about masks. So the posters which talk about the etiquettes or the behavioral practices when you are facing a certain health risk, like cough or you are sneezing, what is it that you need to do? What is it that you need to do after as well? So it's not that just the masks are important, or if you have to wear the mask when you are coughing or sneezing, but it's also important that the masks are disposed of in a proper manner. And once again, it's not just the mask that will protect you from the COVID. It's also about the hand hygiene. So all that goes together. It's about hand and respiratory hygiene. And this is what the schools need to inform the students in a way in which it will be understood, it will be digested, and it will be followed. The knowledge and the practice along with the attitude is necessary. Again, I mean, I won't dwell too much upon this, but hand washing is not just for COVID, as I said earlier. I mean, if you ensure that hand washing is done properly, then you will be taking care of all the communicable diseases, diarrhea, cholera, typhoid. This is exactly where we falter. It's about the clean water availability for hand washing, and it's about soap, which helps or which facilitates removal of germs. Don't go on the numbers that are quoted on the advertisements that are screened on your television screens at home. But yes, indeed, the soap is necessary to prevent the infection. If this is done, the WHO says that you would look towards mitigating the corona the COVID-19 virus in a proper way. And this has been happening. It's not just that it's only being preached by the WHO. WHO has received a lot of flack in all this process, but it's doing a good job in terms of ensuring that people are armed with the necessities that are required to mitigate the COVID. In Norway, as you can see, if you go around the globe, how the schools have fared in these few months. In Norway, the schools opened already in April, and social distancing and hygiene protocols were put in place. If I had shown you the photographs, you would have said that, well, I mean, Norway, the population is not as much, so it's possible. But what is important over here is that they introduced the traffic light model, which guides schools on infection control. So if it is green traffic light model, which depends upon the number of cases within the neighborhood and those within the catchment of the school, that is the parents of the school children. If it is green, then it means that the school can run normal hours. If it is red, then it means that, yes, there is something to worry about. So the class sizes are limited or the school hours are staggered. And if it is yellow, then the preparedness is put into place. So this was about Norway, but Norway is number one in terms of, I mean, is a top country, top Scandinavian, top in the world. What happened in Germany, if we get a little bit towards the southern side of Europe, but even in the schools reopened in August, the important thing that they did was that students were divided into cohorts. Now, what is cohort? Cohorts, they could be considered as small units or groups of students who were assigned to a specific teacher. So each teacher looking after a group of students who were not allowed to mix within each others, so that they are kept safe. Even if a student within one or two of the cohorts is found to be infected, the entire school need not worry about the spread of the disease, because it's only those groups that are interacting with each other need to be quarantined if the need be. So the classrooms were also reconfigured. Again, these are countries in the West which do have the resources to take these kind of actions, where the classrooms are reconfigured and then again put back into the earlier mode. But I have a similar sort of a story also from the Eastern Africa. So it's not just about a country like Norway or a more liberal European nation like Germany, but it's also in Kenya, Rwanda, and Democratic Republic of Congo that the schools have reopened already. And this was done, particularly in the Eastern Africa, this was done after or following the assessments which were carried out by the Ministry of Education, and a certain communication material regarding health and regarding hand and respiratory hygiene was displayed in the schools. What was important was that behavior change was being demonstrated. Demonstrating behavior change is absolutely important. As I said, it's a continuous process. It cannot happen overnight. So this was just a quick run through as to what is happening in the northern and the southern hemisphere around the world. So now, where is it that the South Asia stands? Well, in South Asia, if you look at the second row in these columns, in South Asia, 61% of schools had reported having basic hygiene services. And these figures were in 2016. 72% schools reported to have basic sanitation facilities. And 68% schools reported having basic drinking water services. So in terms of hygiene, water, and sanitation, nearly 2/3 of the schools in South Asia were up to the mark when it comes to the global standards. And as it could be anybody's guess, that most of the lacunae had come from the country which is as big as ours. What or where do we stand? Where does India stand? Well, the Swachh Vidyalaya Abhiyan was launched in 2014 as part of the Swachh Bharat Abhiyan. On 15th of August 2015, the government of India had declared 100% sanitation coverage in schools. So we could be rest assured that all the schools are in a good shape, that they have adequate water points, that they have adequate number of toilets, that they have appropriate hand washing facilities. This is what could be seen. But what is the status? Where do we stand? Well, an organization called WaterAid had done an assessment of school wash infrastructure in 2016. And what came to the light was a little surprising, a little shocking, that drinking water was available in about 84% schools surveyed, of those schools that were surveyed. But it is important to know that about 16% of the schools, and particularly those in the remote areas, lacked drinking water facilities. Almost half of them lacked water storage facilities. So if there is no water storage, it means that the schools depend only on the running water. And if it is running water, then it depends upon electricity. So it's a domino effect that if electricity is not there, then there is no water. Functional toilets found in 95% of schools assist only. Well, I mean, if that is the case, that the toilets in 95% of the schools are functional, then I think that this was really very good, which is closer to what the government had claimed in terms of having 100% sanitation across the schools in India. However, there is some issue that the separate toilets for girls and boys were available only in the 75% schools, and the children with special needs were left wishing for more. Compared to the availability of water and the toilets, so water and sanitation, the hand washing facilities in particular, that is hand washing stations outside the toilets, hand washing facilities lag behind. third of the schools had no running water for hand washing. Again, this is linked to having water storages at the school premises. A third of the schools had no running water for hand washing, and nearly 50% did not have soap. So this is about hygiene supplies as well. It's provided, but well, one doesn't know as to where it goes. So it's not just about, again, it's not just about drinking water, toilets, and hand washing. It's also about keeping the area clean. Solid waste management was seen to be insufficient. And this, mind well, this was done, this survey, this assessment by Water Aid was done in the year 2016. So I do believe that that there has been an improvement in the different aspects that have been listed over here. What bothers me a lot than the in terms of the infrastructural or physical lacunae is the inability of the teachers to understand and implement the hygiene-related protocols. The assessment said that almost two-thirds, 66% of the teachers interviewed had not attended any training on hygiene and sanitation. If this is the case, then how would we be able to ensure the behavior change within our students who would be joining the schools after a gap of 7 months after the schools reopen? That's something that needs to be pondered upon. Where is it that we could look? Can we think about adopting the red light traffic model used in Norway? Maybe we can think about staggering and limiting school hours. In Andhra, as I earlier said, in Andhra, they have already staggered the school hours for the different classes. So if it is 5th, 6th, and 7th class, then they come on certain days. And if it is 8, 9, 10, they come on other days, which also means that the facilities or the adverse student to wash facility ratio, which normally should be 40:1, which means that 40 students per toilet facility, per toilet seat in the school, which is kind of adverse in the Indian school ecosystem. If the classes are staggered, then this could be taken care of. If the classes are done on alternate days, then the adverse student to wash facility ratio could be managed. Also, that the school premises would allow more space for the students if the classes are staggered or held on alternate days. Which also means that as we allow the students into the schools, we have to look at how we are able to control the spread of the virus, while at the same time we engage in improving incrementally, gradually improving the wash facilities. All this is well said, but I don't know whether this system will be too much taxing on the already burdened teachers. I mean, they have to, the poor fellows, the school teachers of all the Zilla Parishads and the panchayats and all. I mean, they have to look after every single need that the government has, from the census to the surveys and whatnot. I mean, they're burdened with everything. So having these classes or repeating these classroom hours, would this not be taxing for the already burdened teachers? This we need to definitely look into. But what I would say is that yes, indeed, there is a sense in using the traffic light model that is there in Norway and adapt it to the Indian context as well. What is equally important, or what is much more important, is that these three different gears that are functioning over here, the education department, the school management committee, and the school hygiene clubs that are there in the schools within India, as the Washington Schools reports indicate, they need to work together towards collective decision making in keeping the students safe and all the stakeholders safer as well. But more than that, they need to work together to ensure that they are influencing the policy. Why the policy needs to be influenced is because they need to ensure sustained fund flow. They need to ensure the sustained fund flow to further facilitate the development of infrastructure, even if in a gradual manner, and at the same time, facilitate the behavior change over a gradual period. They can think about convergence of the different schemes that the government runs to make the fund flow happen. What is equally important is that regular assessments need to happen. Rigorous monitoring needs to be need to be happening at the school premises, and detailed reporting of who is there, who is not there. Well, I mean, this is the season when there is a chance of having an increase in the dropout cases. So we don't want the school age children to drop out of the schools only because of this 7-month hiatus. So this needs to be definitely looked into. This is what this is the checklist that the Government of India, the Ministry of Human Resource Development, has come up with. It talks about how every school that is reopening needs to look into, and there are issues that are focusing specifically on water, sanitation, and hygiene. For example, it talks about students and staff. So the key stakeholders having been sensitized on good personal hygiene practices and proper hand washing techniques. Now link it to what I had told you earlier, the survey that was done by our NGO. It said that 2/3 of the teachers didn't have adequate knowledge about the personal hygiene practices. So this becomes very important. Signages, which means posters, which means communication material, IEC on the health and hygiene practices. Adequate number of clean and separate toilets for girls and boys. Soap and water available at the hand washing stations. Health and hygiene lessons integrated in every teach. If this has been done earlier, wonderful. If not, it's right time to start it. School premises and surfaces are cleaned and disinfected. School premises are ventilated and could be more airy or could be more open. Adequate cleaning staff is available. Trash is removed and disposed of daily basis, and student and staff are screened regularly. Again, all these are tough tasks, but we have to follow them to ensure that the environment stays safer and the students learn. Just to quickly recap what I had been talking about, well, education is the fundamental human right, but COVID has deprived 1.6 billion school-going children from learning. Globally, the governments believe that pursuing appropriate policy would help in mitigating the consequences. The immediate policy response focuses on prevention of virus transmission and ensuring safety of stakeholders, and nothing else. Suppression of virus transmission. That's why what is important is hand washing and respiratory hygiene. So hand and respiratory hygiene. Functional, adequate, and accessible wash services are essential to tackle the spread. And this cannot go without participatory decision-making process with assured fund flow for institutionalizing COVID-19 mitigation in schools, because no one knows as to how long we are to be in this state. That's all for me. Instead of keeping children out of school, teach them good hand and respiratory hygiene practices, which would help them in school and elsewhere to help control coronavirus. Stay protected.
Thank you. Thank you, sir. Thank you for nice presentation. Now I invite to next speaker, Dr. M.S. Khan sir, for share presentation in front of participants for today's webinar. हम लोग क्वेश्चन आंसर बाद में करेंगे, आप जो 3 प्रेजेंटेशन हो जाने के बाद ही कर सकते हैं सर। तो लास्ट 10 मिनट में हम लोग क्वेश्चन आंसर करेंगे। और मैं खान सर को आज के इस वेबिनार में प्रेजेंट करने के लिए इनवाइट करता हूं, और मैं उनको एज ए प्रेजेंटर का रोल अभी करता हूं।
Thank you much for giving the opportunity, rather you can say, to speak something about the wing. And thanks a lot for Ray Sahab, Ranjanji, Prasadji. Now, today, already Prasadji has already, rather we can say, focused on many things. Now, I will be rather, you can say, what is actually was how the can see and how, if you say total scenario, how it has been changed and what are the precautions you are taking in the infection prevention control in the COVID-19. That is one of the important factor here. Now, if you go to the in the pre-COVID, when you go to the school side, the washing school side, the safe and adequate drinking water was there. Gender segregated toilets were there for the girls and as well as the boys, and the urinals also. Hand washing facilities were there always, because within the toilets as well as with the dining area MDA. Safe disposal of the solid and liquid waste, it was carried out, no doubt about that. Health and hygiene, health education, and the behavior change also it was there. And to certain extent, the operation and maintenance part was there. Now, when the COVID has come, the additional burden has been induced there. That is use of the mask, physical distancing, respiratory hygiene or etiquette. Improved linen management, because there are the hostels are there are schools are there. The important for that. Safety and hygiene. There is another thing has come, which is psychosis or other psychological support to be given for the additional support of the consideration of the COVID-19. Now, if you go to in the tiers of the schools and hostels require the higher level of preparedness to control the COVID-19, you have to see that always use the mask, already has been told, respect all etiquette, know everybody, but it has to be taken care. Hand hygiene, see, there are only thing is there, here the hand hygiene emphasized to sanitizer, use the sanitizer or alcohol-based hand hygiene. No, it is the most important factor is that you have to wash your hands with the soap as well as with the water. So it will be giving the much more effective on the part of prevent the COVID-19. Then making the physical distance 2 gauge, 6 feet, you have to maintain the physical distance. Then you have to go for the environmental cleaning and disinfection. Now, there are a lot of functional wash facilities were there. There are also not there. Now, during this COVID, we have to take such a way that there are a number of suspected cases are coming up. So we have to give the support them. So these are the burden further, other you can say, to the schools. That school, when it was there, the washing school habits were there. Now this additional system has come, which is giving the more burden for the school factor. Now, if you see for the information for the prevention and control of the school, then we have to see that there are residential schools, there are compound, there are living other rooms, there are dormitories, halls, dinings, kitchen facilities shared by many persons. So prone to spread of the COVID-19. So that part has to be taken care of. And if you go to the wash facilities, so there are water, there are toilet, there are hand wash facilities, there are cleaning of the environmental sanitation, linen management, solid and liquid waste management, and food hygiene. These all things are there. Rather, you can say you have to go as per the line and length of your COVID control or as per the prevention control. Besides to that, the important factor is coming, the psychological support, which is enabling the environment as well as with our students, our teachers, they will be taken care of. Now we'll go to what is actually washing school, how it is there. Rather, you can say what are the supposed to be washing school will be there. So if you go to the washing school package, there are supposed to be drinking water, source, quality, water treatment, and purification. Hand washing, cooking, rather you can say MDM, cooking, and personal hygiene. When you talk about the personal hygiene, there is your menstrual hygiene is coming. Then sufficient water for the cleaning, flushing the toilets, school farms, kitchen gardens, as well as appropriate measures will be taken for the liquid waste management. Then toilet facilities should be sufficient, adequate, child-friendly, gender specific and culturally appropriate. If you see, there are a lot of toilets are there. The toilets monuments are there. But if you find that those schools toilets are not being child friendly, they are not being gender specific, they are not being culturally appropriate. So for that you have to be there. That is the specification by the government of India. So now the separate and well-maintained facilities will be there. If you see the washing school chapter, the three things must be there. That is the safe drinking water, provision of the safe drinking water, sanitation facilities. When you talk about the sanitation facilities, it is comprised your MHA as well as solid waste, liquid waste, and also hygiene. So when you talk about the hygiene, there will be hand hygiene, there will be drinking practices. There are a lot of practices which involve the hygienes. So like that, this should be in the curriculum also. There may be wall painting, there may be competition, there may be control measures. So these are the hygiene education can be taken to in the washing school chapters. But why? These are all is related to the illness, approach to the control vector diseases as well. When you talk about this thing, these are the essential package. In the essential package, a Swachha Vidyalaya can be, rather you can say, tell a Swachha Vidyalaya where the hand washing with soap should be there, gender separated toilet should be there, improved capacity of the persons, teachers, as well as, all the affected by the schools, then operational maintenance part, then the behavior change. If the behavior change is coming, we will definitely, rather you can say, notify there is a change. And if there is a change, definitely will lead to a Swachha Vidyalaya. So for that, these are the essential package of see how this is now you know already that water source should be there, pipe water should be supplied there, should be there, safe storage of water facilities there, water tanks should be there, water quantity and quality, the quantity should be there, how many children are there, how many students are there, what is the quality of the water, whether the quality has been checked or not, whether it has been tested twice or not, whether it has been tested for the biological contamination, whether it has been tested for the chemical contamination. Then safe drinking water provision, whether there is a filter or RO, and water contamination, water connection to the toilet as well as hand washing stations. Then one of the important thing is that there are a number of schools are there without the rainwater harvesting. So these part of the things we can review very well, rather we can say go for the rainwater harvesting and we can convert the water for our reuse or recharge. Even if you see that there are a lot of, rather you can say, schools are there, those who are developed the kitchen gardens with the help of the grey water connection. So that part is supposed to be there with the drinking water side. Now if you go to the water side again, same way, safe drinking water for the within school premises, adequate quantity of the drinking water, safe storage of drinking water, periodical water quality testing, adequate quantity of water for the toilet, adequate quantity of the water for the hand washing, and practice of the water conservation within the school. This is the water, significant water can be used for the school for this purpose. Now, if you go to the other part, if you go for the other part, you see, you can see varieties of the water uses you will find there. In the Rajasthan, if you go, the tanka will be there. And if in the other places you will go, there will be different uses of water apparatus will be there. So, starting from the point, whether the schools are having these or not, that is one of the important. Now, if you go for the other purpose of the water, water can be used for the toilets, water will be used for the hand washing, it is already being told, and water also will be using for the gardening purpose. Now, if you go for the toilets, in the toilets, one side you see the toilets is meant for the boys and the girls as well as CWS child. Then urinals for the boys and girls, MHM, menstrual hygiene for the dustbins and incinerators. These are the mandatory things supposed to be there in the schools. Water connection supposed to be there in the schools for the MHM purpose, and safe disposal of solid and liquid waste, as well as if you are using this, you can use with the compost pit or soap pit. Now for the components of the sanitation, if you see, the availability of the separate functional toilets for the boys and girls, availability of the separate functional urinals for the boys and girls, separate toilets for the children with the special needs, availability of the child-friendly design for the toilets and urinals, separate toilets for the teachers and staff, availability of the toilets with the secure door, latch, hooks, roof, and proper ventilation, availability of the facilities for the menstrual hygiene management. It should be there. And it is there or not, that is something else. But it's supposed to be there. But in the COVID, when the COVID is coming, how the things is being changing and what are the precautions we'll take, that also latter part will see it. Toilets, that should be toilet blocks should be there, 1 WC and 3 urinals is a toilet block, that should be there. The menstrual hygiene part is already being told. Now we'll go to group hand washing stations. If the group hand washing stations is there, see in the Orissa is one of the beautiful thing it has come up. It is the MTMC, multi-tap. And after that, it has been changed the scenario that group hand washing station. And now that in the COVID scenario, it has come to the minimal hand touching, washing hand with soap. So now things has been changed. Washing station was there. The number of the children, they can wash their hands. Now the minimal hand touching by the hand and washing the hand with the soap, that will see in picture, we'll see it, how it is there. Now you see, if the hand washing, you see, number of children at a time, they can curiously wash their hands across the area. They can stand easily and they can wash their hand very well. They can soak hands to each other. But when the other part you see, here what happened, we have been experienced that during the summer vacations, the taps are being stolen away. So now it thought in my mind that why not to go without taps? So using the without taps, there is no tap is required. Only one valve will be there. If you look to this picture particularly, there will be only one valve and the valve will be open. The orifice hole will be there so that the water will be rather you can say coming out and you can very well wash their hands. Now here there is one happened. Here there is that you can retrofit in the COVID because what happened? There are series of taps are there. You close one taps and there the distance will be maintained. So it can be very well be retrofitted there. And here if you see this picture, you can very well find out the foot operated hand washing station has been generated. So you can very well, by the help of foot, you can operate it by for your getting the water at the same time getting the liquid soap. Even also here, the elbow taps can be used. I mean, elbow operated taps can be used in different way. You will find these elbow operated taps are being used in the health facilities. So in this fashion, we can in many ways, you can insert retrofit, we can bring to the rather you can say action of the COVID-19 during the COVID-19. Now in Orissa, we have found that in the number of, with the help of the UNICEF, we have rather you can say given to the number of schools, jails, as well as hospitals, as well as marketplace, as well as offices, that minimum hand washing stations can be given, and it has been also given. This depends upon one of the biggest things is that the capacity building, because what happened, we create all the features, we create all the infrastructure facilities, but rather you can say if you are not giving the building of the capacity building, then it will be not easy, that easy, and to give the proper operational and maintenance part. When you talk about capacity building, it is not as the Prasad has told, that is not a one-day job or is a 1 hour job. It is a process. If that process goes, slowly it will come up and you will find there is a change. And definitely there is a change. When the change will come, definitely it will be told that the change has come. Now, what are the challenges? If you see, already we have seen that the COVID has come, then what are the features of the washing school? Now, what are the challenges? The governmental schools used as a corona care centers and for the housing migrant laborers. Dual challenge for the handling over-informed and under-informed. Managing stigma and social ostracization and students coming from the COVID-affected families. Possible solution, normal guidelines, national guidelines for the sanitation measures, communication products for the parents and students, intensify enrollment, marketing, and medical facilities to be supplemented with the psychological counseling. See, these are the challenges, rather you can say, coming to the school. Now, next is challenges, limited availability taps and the water frequent for the hand washing. As is being rather you can say told, there are some hand hygiene, rather you can say your stations were there, with the limited facilities, with the only 2 or 3 facilities, or only with one hand pump. Now these facilities has to be increased. Now we'll see in the latter stage, what are the other, you can say, minimum standardization required when you are reopening the schools. That part will be seen. And in the next is challenging practicing the physical distancing. This is one of the rather, you can say, vigorous point. Because when you go for the physical distancing, it will be, you have to maintain physical distance 6 feet. So when you are maintaining the physical distance 6 feet, but how rather you can actually maintain in the classrooms? So that they have to go for the shift wise. They have to go for the shift wise classes. They have to make 2 hours for these classes, another 2 hours for other classes, another 2 hours for other classes. So the guidelines rather you can say is being rather in process and is going to be issued on this part. Then sustaining cleanliness and hygiene practices. That is one of the important factor, that what are the areas we will take very vigorously, that our strengthening the part of hygiene practices will be strengthened, and further rather you can say we will try to prevent. That is most important. Now when you talk about the COVID-19 situation and the preparatory activities, if one by one, if you go one by one is the preparatory activities you go, then you'll find that this is the preparatory activities. Number 1, that if your school was alerted with the shelter of the COVID-19 infected people, thoroughly sanitize 3 times before the reopening, and stagger the dates and time students to the return to school open reopening, train watchwomen and ANM on screening of the COVID and various parameters. Instruct students, teachers, staff and visitors to stay home for unwell, if unwell, and provide 2 reusable cloth face masks to all students, teachers, staff. Instruct them to use face masks every day and wash there after use. And stock disposal of face masks. Provide gloves, gumboots, and provide gloves, face masks, head caps to the staff and the dining area. Okay. What is the cleanliness in the hygiene? Cleanliness in the hygiene. Carefully and dispense all the areas in the school with the help of the daily and weekly checklist. Educate everyone to wash hands frequently with the soap and water for at least 40 seconds. Reminded not to touch face, eyes, mouth and nose. Not to share cups, plates, glasses or food or drinks with the others. Ban spitting in school premises. Convey hygiene messages through posters and signage at appropriate locations within the premises. Physical infrastructure. Ensure all rooms are well lit and ventilated. Implement low-cost, affordable hand wash stations. Ensure availability of soap and adequate water. Demarcate area to wash clothes. Provide enough water and space of the. Encourage water conservation and water management. Physical distancing. Revise and extend the timetable to incorporate staggered timing. Snacks should be served in the class open areas. Extend and stagger meal timing when they ensuring 100% hand wash. Avoid morning assembly sport as well as all activities that requires large group for gathering. If group meeting are required in small group size that permit physical distance of 1 meter between participants. Visitors' parents should be allowed only in the designated days. Stagger the visiting hours with the break every hours. Student environment. Designate Swachh committee or Swachhata committee remembers to pass as a hygiene leaders. Conduct the Swachhata committee members to assess the situation and identify measures, activities for the next week. All hygiene leaders and Swachhata committee members should be trained on the operation procedure. Ensure students to speak about the COVID-19 and clarify all the queries, concerns with the teachers. Look out the change of the behavior in students and provide counseling support to dispel every worry and confusion about COVID-19. Create an environment where the students feel comfortable about informing hygiene leaders, teachers, ANMs about ill health. Counsel all students and staff to be empathetic to those unwell and not indulge in stigmatizing. Then infrastructure, what the infrastructure facilities are, how it should be. Entrance gate. Keep entrance gate locked in the minimized movement for the people's goods. Install a bell at the gates movement. Register should be maintained. Disinfect gates twice a day. Day watch men and women should wear face masks and gloves. Keepers should always carry hand sanitizer and food supplies and other deliveries should be dropped at the gate. Sanitize all the materials being coming to the campus school premises. Disinfect entire premises including walls, sitting facilities in open areas. Disinfect handrails, dark knobs, switches, the surfaces of drinking water, containers, hand washing stations, toilets, wheelchairs, equipments, etc. Display communication messages regarding the hygiene measures at appropriate locations in the premises and the classrooms. Premises to be kept clean, free of garbage, logging. Dormitories, clean and disinfect in the floor. Use the sleeping at least twice a day. Maintain at least 1 meter distance or 2 meter nowadays. Now 2 meter. When it was done, it was 1 meter is written. 2 meter distance from one bed mat to others. If required, convert some classrooms, library, visitors, room, etc. into dormitories for the evening. Ensure that children are sleeping in opposite directions, head or one leg in other. Rugs, blankets should be exposed to the sunlight on a rotation basis. Use naphthalene balls as a disinfect for the rugs and blankets. Bed sheets should be washed once in a week. Ensure good ventilation and sunlight in the dormitories, and ensure that dustbins with the proper lid and placed outside the dormitories and emptied regularly. Classrooms. Disinfect surface such as desks, tables, and switches twice a day. Students should wash their hands with the soap before entering the classrooms. Maintain a physical distance of 2 meters between students, stagger class timings, and split the class into 2 groups if required. Clean and disinfect hand washing station and toilet blocks, including urinals, latrines, flushing tanks, taps, dark knobs, doorknobs, buckets, and mugs twice a day. Sanitize surface of incinerators and sanitary pads, vending machines if any. Ensure toilet the student ratio of 1:20, 1 toilet for every 20 students. If the toilet are lesser than, prepare schedule to avoid other crowding. Ensure hand wash point is 1:10. Or further, every 10 students there should be 1 hand wash point. If lesser than, start the timing. Maintain hygiene, environmental within the toilets. Use of fresheners and balls. Always ensure the availability of the soap at the hand wash point. Ensure running water of the storage facilities to allow the increased frequency hand washing and cleaning. Clean small drinking water storage containers daily. Clean large water storage containers for other than drinking purposes at least once in a month. Clean overall drinking water storage of facilities once in a 3 months. Get water quality tested once in a 6 months. That is for the biological testing twice in a year, and for the chemical testing once in a year. Janitors should be wear face masks and gloves while cleaning any area, and also gumboots while cleaning the toilet blocks, staff room and principal room. Clean and disinfect the staff and principal room. Always sanitize your hands before entering the room. Rearrange the sitting of the room and maintain 2 meter distance between people. All meetings with the visitors should be held in the visitors room. All internal group meetings with the student staff should be held in the visitors room. Disinfect the visitor after every meeting. Library, lab and meditation hall. Disinfect the room, equipment table, chairs, equipment, computers twice a daily. Everyone should be wash their hands with the soap before entering the room and touching the objects. Allow only those games, sports that can by maintaining the physical distancing. Dining area, cooking, serving and eating area and surfaces before and after the every meal. A safe distance to be maintained between the children while chewing and while eating. A separate area to be earmarked to provide food or visitors, parents. Hand wash with soap prior to entering the dining area. Plates, cutlery, serving dishes to be cleaned properly in a warm water. Kitchen and storeroom. Milk packets, vegetables, fruits, etc. should be soaked in a salt water for at least 1 hour before using the storing. Clean and disinfect the room, all surfaces, objects, containers twice a day and after the refilling the stock. Sanitize all utensils carefully. All kitchen staff should be always wear face mask, gloves, apron and headdress. Medical room. Clean and disinfect the room and all surfaces twice a day. Schedule checkup all the students once in a week. At the time of requirement, convert the room into a quarantine facility. Student with an indication of the COVID symptom, fever, dry cough, breathlessness, tiredness, to be shifted to the nearest hospital. Ensure availability of the first aid kit, medicines, sanitizers, masks, gloves, and sanitary pads. On this part, when you can say you're covering all these features. Now there will be the recommendations. Further, you can say from the NIDM to the ministry. Now these are the points I have mentioned here. That hand washing before entering schools, all students and teachers and others should wash their hands. So at the entrance of the gate, you can say these facilities should be maintained. School, they have to wash their hands with the soap and water and they will enter to the schools. Water availability. Sufficient water and hand washing stations with the soap should be available. So by that, the process of the hand washing can be completed. Supplies like the soap, gloves, mask and cleaning materials should be available throughout. That there should not be any supplies gaps. Cleaning and disinfecting. Sufficient stock should be within the school for the cleaning and disinfecting the areas. Waste management. Well protected solid waste management and liquid waste management. Either there should be soak pit or kitchen garden or main drain, or the solid waste will be there to lift by the municipality, or it can be rather you can say go to the compost pit. That arrangement should be made. Physical distancing at the entry point, at the MDM when the midday meal is given in the classrooms. Establish a monitoring team. That is one of the most important feature, that a monitoring team, whatever the rather you can see is being read out or told to you, that will be only possible provided if you are having a vigorous monitoring team is there. So that is to monitor the things. And orientation training. That is the important thing, is that though all the things are there, but if the particular capacity building of the all stakeholders is not being taken care of, I don't think that there will be a proper orientation or proper capacity building will be taken place. Checklist. There should be checklist at school entrance. There should be checklist at classrooms, and there should be checklist at the toilets. So all these checklists should be placed. So by your school cabinet or the SMC members or whoever is coming, they can hour the things and they can able to see the things, whether it has been do's or don't. Hygiene, culture of hygiene in schools, hygiene behavior, and change the community. So this is from my side, and I think now I give the mic to the Ranjan.
Thank you, sir. Thank you for nice presentation and very insightful presentation given by you. And sir, you have highlighted different points related to issue, challenges, and washing facilities and infrastructure facilities, and related to medical facilities regarding to COVID-19. Preventing mitigation measures for preventing and mitigation. Now, I invite to Shivani Rana for as a next speaker for this webinar.
Thank you everyone. Can you please give me a permission to share my screen? Thank you.
Yes.
Yes. Thank you, Prasadji and Khan Saab, for really capturing the WASH component in this context of COVID-19. And I'm sure there are participants and a lot of people are already hearing to you all and understanding the how the WASH part is section is getting affected, and what is the COVID-19 impact overall, and also bringing in different lenses, like Prasad ji has been speaking on the education part, and then Khan Sahab has also led us through the different infrastructures, how they can be there. We can set up best infrastructures in those contexts. So from my side, I will be mainly focusing upon now a very important lens in the COVID-19 context, which is gender. So I'll be speaking through that, and I'm sure after that we'll get a chance for the question and answer rounds also. And if anything comes up, so please feel free to ask me. So here I will start my presentation. Okay. WASH in COVID-19, as already I have mentioned, Prasadji and Khan Sahab has already spoken a lot, and they had really shared their experiences and their wider knowledge around this sector. So I'll be just very quickly here emphasizing and connecting it with the gender part, as I mentioned. So WASH, it is very important to have access to the safe WASH services, especially in the context of emergencies, as already has been mentioned, and also which to increase the resilience of communities. What I will be mainly focusing upon and speaking on is how our communities are withstanding the water stress they are feeling. Apart from the hygiene and sanitation issues, the water stress they are facing in at the community level. And when we talk about WASH, it is not only there is a holistic approach we always take. We don't talk about only water, we don't talk about only sanitation or hygiene. So it starts with ensuring safe drinking water, but also water for the usage, and adequate sanitation facilities, practices, and the overall hygiene and awareness part of it. And also, if we see in the recent COVID-19 context, the impacts were very complex and very versatile. I mean, they were multifaceted. You know, there are different layers which has been applied through this context. And as I'm saying, it is not only a standalone kind of sector, but there are a lot of integration and intersectionalities are also coming into that, you know, across various themes. Especially when you talk about power, when you talk about gender, inclusion, inequalities in the society which is pertaining. So how this COVID-19 actually impact upon people through these different lenses and layers is completely different thing to see. Especially when we talk about COVID context, it's not only related to hygiene, although we know hygiene is more prominent in this sector, but again, water supply and sanitation also, they play a big role. That we will be, of course, now in the coming few minutes, I'll be just taking you through that. So, okay. Let's look at what is happening around us in this COVID-19 time. There is this quote which is very famous, we usually use in the disaster context, that no one size fits all. Differentiated impacts and context are there. So it means that not everyone, like I will be differently affected by a disaster. Then there is another friend of mine, he or she will be differently affected by a disaster based on their vulnerabilities. Similarly, when we go in the communities, there are different kind of context people live in. So they will be differently affected by this COVID-19, or you call it any emergency. They will be differently affected. For example, we talk about women, we talk about persons with disabilities, then we talk about people who are from the lower caste system, who are facing the discrimination. Hanji were talking about Odisha. Odisha is one of the states where we see a lot of such cases, and not only Odisha, but there are many other states where we see the social discrimination among the communities and the stress and stigma they are facing at this stage. So this is what, like, any disaster, be it COVID or be it natural disaster, they always impact a person differently based on his or her vulnerabilities and the risk around the person. As I was mentioning that today I will be speaking more around the gender section of it. So how COVID-19 has impacted women and the adolescent girls, that we need to really see and really need to understand that how they are being affected in these times. So gender-based violence, as we all been hearing when since the COVID-19 has hit India, not only India, but even other countries also, as I'll be bringing a little bit of my experience of working in the other countries also as part of my organization. So that is something we've been hearing, and there has been evidences which came up that which says that there is a growing violence against women who already are bearing the stress of having caste stigma, especially in reference to India, then different ethnicity, minorities, and other vulnerabilities. They can have different layer of vulnerabilities. Women can have different layer of vulnerabilities that we talk about in this outbreak. So during the COVID-19 outbreak, there are families who will have higher demand of water in order to meet the increased hygiene needs. So it's not only for the drinking purpose, but now we need water for washing our hands also. So we need water. What about those places where there is a large, huge scarcity of water? That something is we need to see. So hygiene needs, so it is possible that the situation may make women and girls more vulnerable to this form of, I would say, to the protection issues like abuses, especially when we talk about climate change in this era, where there are a lot of areas, lot of states and places which are right now struggling with the climate change issues. There is huge scarcity of water. If you go in the villages, especially, let's take an example of Bundelkhand area of Madhya Pradesh and Uttar Pradesh. So there, women has to go miles of miles, to fetch water for drinking. But what about now? There is another thing which has come up is to maintain the hand hygiene. We need to wash our hands. हमें हाथ धोने की जरूरत है. उसके लिए भी पानी चाहिए. So can you just see from that lens when they have to walk miles and miles to collect the water, and especially in the isolated areas, because in last few months you all have faced lockdown situations, which brings in that there should be no one outside. And sometimes those kind of fragile situations, it makes really kind of, unsafe for women to go alone, get water, where they can be exposed to the risk of physical abuses and any kind of abuses. So that's something is the another lens we are bringing into this, is that which can have, a different level of impact on the women and the adolescent girls. Now, I would like to talk about, again, when we talk about the impact of COVID situation, when we relate it with WASH and also we relate it with the gender. So, I'm sure you all are aware that most of our health and social sector workforce, we talk about ASHA worker, we talk about Anganwadi workers, they are all women, most of them are women. And they are more exposed to the risk of COVID-19 because they are the caregivers. they have to aware communities on health and hygiene awareness. So such campaigns are running. And as per one of the study from WHO, World Health Organization, they say 70% of global health and social care workforce are women. I'm not talking about women who just work in any other sector. Their women's percentage is not really high, but this is one of the sector we are talking about, especially in Indian context. Like I've already mentioned, women who work with panchayat, who work at the block level, city level. So they're all exposed to such issues. So that is another thing which add up to the COVID-19 impact. Then I'll talk about the menstrual hygiene in general context of disasters. We always talk about menstrual hygiene management, where we have seen on ground. I mean, that's what we've been working with communities in different states like West Bengal, Bihar, and Odisha. So we came across with such cases where women feel panic buying sanitary napkins, which results in limited access. Then due to the economic impact, you have very less money. You are hardly managing your one-time bread, So then you need to spend another amount on purchasing the products related to menstrual hygiene. So that's basically make it very less affordable for them. So they prefer something else over having these issues. So another setup is in India, it is still a stigma and it is still a taboo, which we all are working around. That it should be, it's normal. It is not something which is abnormal. So these barriers, they are again putting them at the risk of, not really going out and accessing such things. So which brings a lot of hygienic issues for the women itself. And I'm sure, as I've mentioned here in the slides also, it is still unreported and undiscussed. Not many people are discussing around this. Very few, if there would be, they will be discussing around that. Another thing is, well, we are talking about quarantine centers. You've seen that in India, a lot of quarantine centers were open. They're still open in some of these places. There are communities. I've seen a recent example of West Bengal, where we are right now implementing our projects on COVID-19 as well as cyclones. So there we had seen and we heard from the women itself, and we had the conversations with them. They said that there were hardly any sufficient safe space for women in the quarantine center. They don't feel safe in those. There are a lot of physical and sexual abuses which they are facing day-to-day time, even mental abuses also. So those kind of things are there. And then we talk about wash facilities in those centers. They're completely undermined in many of the centers, and which is further emerging the protection issues for women and adolescents. So one of the study again, which came from Ebola crisis, because a lot of people, they relate this COVID-19 outbreak with the Ebola in West Africa and DRC, where women were frequently consulted than men, and as consequences, women were less frequently consulted. They were hardly being consulted than men. And what happened due to that? The needs and requirements were often went unmet. People hardly knew that what are the needs of women than men. It's completely different. There's a different layers into that. So these are some of the findings, which also, it's not that something we are observing, but that has been studied well also in previous outbreaks, and this is what it comes out to be. So as I was mentioning, the layers of vulnerabilities. So here I would like to give an example, like, you can see in the slide a woman who's living in any of the community. One is that there is a gender. I usually don't say that gender is a vulnerability, but then still we are in a kind of society which puts us into different kind of stigma and stresses. So if you see a woman, one vulnerability she might have is that she might be from the lower caste. She might be from the indigenous groups, like we have tribal and here. or minorities, and like caste I already mentioned, like Dalit women. And you just imagine the women who might be Dalit. Let's take an example. And then she's pregnant. She has another vulnerability. And then let's take another layer, is that she might have some disability, right? She might have physical disability, she might have mental disability or any kind of disability. And then let's say that if she gets COVID-19 infected, can you just imagine the stress over the women and the vulnerability and the risk around that particular women, how huge it can be, and what are we doing for such people? I would like to give an example here, as I work with Change Alliance, which is a wholly owned subsidiary of Christian Aid. It's a global organization which works in different countries. So here in India, we are working with the different NGOs and partners. So one of our partner, FIA, who's working in Bihar, they are very much active. So they did some study, and they come across with the case study where a woman who was infected with the COVID-19 virus. So what happened now? You know, women, they are responsible not only to work outside and all, but again, of course, her major responsibilities towards her family, to manage her child, her family, and everything. So she's anyway all-rounder. I won't say that women is vulnerable. Women are one of the most strongest person are there on the earth. I would say stronger than the men. So what happened is her child just came out. She was COVID infected, and just to get her child and get the child inside the house, she just ran out. And the moment she ran out, people are already seeing her from a different lens, and they're seeing her that, okay, this woman, she's a COVID infected. She should be stayed away from us. The moment she came out, people started attacking her with stones and with sticks. पत्थर और डंडे बरसाने शुरू कर दिए ताकि वो घर के अंदर भाग जाए. What I mean, she's just infected with COVID, and then what happened is she's also carrying another stigma, is being a Dalit woman. And these people, sometimes we don't really make them kind of understand they can also be a human being. That's another layer of inclusion or exclusion, I would say. So this is what has happened, and I'm talking about the Dalit community in Bihar, which is also called Mushahar community. So this is what happens with people who carry a lot of vulnerabilities and a lot of a lot of vulnerabilities around them on the shoulders. So this is something, one of the important point to see, that how vulnerabilities and exclusions, errors play a different role with the person to person. Now, I'll be just moving towards, I'll be speaking very quickly, and this is, I think, few of my last slides. So looking at the time also, there are a couple of recommendations based on which what I have mentioned, that how women can be affected, especially if they have different level of vulnerabilities during such COVID situation, and keeping wash in mind, the water availability, sanitation, health and hygiene. So there are a couple of recommendations which I may suggest here, is to have a gender responsive mechanism when we work in such pandemics, when we work in such context. So providing special provisions and care for the women front workers who are the caregivers who work with government. Especially I'm talking about ASHA workers, Anganwadi workers, and any other workers, female workers who are there. Then initiate gender-sensitive programs at community level. This is really important. Although in this COVID context, we may not be able to engage a lot of, gathering of communities and having a program at that level. So just to avoid the social gatherings, we may have household level programs also, or even if we are doing it at the community level, we can just maintain the distances, which Khan Sahab has also mentioned in his slides, keeping a distance, proper distance between the people, and organizing such psychosocial support programs for women, but even as well as for the men also, just both to contribute to challenge the gender stereotypes we are carrying in the society. Then to promote the community surveillance and support, continuing support, through the help of networks. We have a lot of networks, as many of you would be aware about self-help groups we work with. Then we have formed many other groups where we just make a group of women who just go and aware people, sensitize people on different other things. So we can have them, and then especially who belongs to the marginalized groups, to make them empowered, to tell them that you are not less sufficient than anyone else, but you are powerful in yourself. So having these groups so that we can just work with communities to bring them out from the social shocks. Wash committees can be made at the village level and panchayat level, where we can have more women so that their voices can be heard, so that we can know that what is the best possible solution. I will not give you the solution, but the women with whom I'm working at the village level, at the communities level, they should be there to for the decision making. They should give us the solutions and responses rather than we do it from our own. Then yes, women are play a major role in terms of ensuring hand washing at home. They can sensitize their family members. They can ask their husband that you wash your hand and then only I'll give you the food. So that can be a kind of approach we can build in within the communities. Second is water points. It's a very common thing. So making water points, especially if you have hand pumps, tube wells in the villages, they should be safe and accessible. It should not be really far from a house. We have sphere standards. We talk about a lot of international standards, which gives us a kind of guidance and guidelines that how far a water point should be from a house. So that is from the protection perspective, again, for women and adolescents and girls. Then redistributing water collection responsibilities, because in our society, it is already understood by women and men that it is only co-responsibility of a man to collect the water. No, that's something now we need to keep bring these changes within the communities itself, where we all are responsible to do that as we work with them, for them to think about redistributing responsibilities of water collection. If man can also go for the water collection, there is no harm. His ego, that will not come down. But that's something I understand completely. Being in India, this will take some time to completely change this approach. But yeah, we can still do start to make these changes happen. More sensitization required at the community level, as I already mentioned, to enable menstrual hygiene management provisions easily available at the community level, so that women don't feel unsafe to go out and then again undermining her hygiene of facilities in such situation where lockdowns are imposed, where a lot of restrictions are there in the movements. Then implementing plans at community level. Our government, the various departments, NDMA, NIDM, a lot of other departments who already, SDMs at the state level, DDMs at the district level, they're already implementing a lot of brilliant plans and wonderful plans on ground with communities. However, I would also suggest here that, and the other organizations, NGOs who are working with the communities, the one suggestion is when you design your program, it should be gender sensitive and inclusive. Please have most marginalized communities and women participate in different programs, especially when you're going to design such plans, which is going to be implemented at the ground level. Even for the policies also, different plannings when you do, please involve people for whom you are making such plans. So the participation of community itself should be really important at this in such works. Then collecting, systemizing, and analyzing genders disaggregated data. Yes, sometimes we don't take gender disaggregated data. We just take number of people, but do we know how many men and how many women are there? These kind of data really help us to plan for the long-term visions and long-term planning for COVID-19 if we are going to reduce the impacts on the society. And then it also curtailment of social, cultural, economic, civil, political rights. That also comes into that when we consider such things. And at the end, it is really important if the communities are also socialized on the best practices of water, sanitation and hygiene, as I mentioned, as a holistic approach, that's something we should take. So that is there. So, all right. So I think I'm with so few recommendation and suggestion. There can be a lot, of course, but these are a few of the things which I feel is we can capture here in this discussion. So with that, I would say thank you to all the participants, especially who just get time from the busy schedules and participated in this exercise and really listen out to us. Thank you so much. And with that, I'll hand it over to you, Rakaji.
Thank you so much, madam, for such a nice presentation. Now I hand over to the Reza sir for facilitating the question hours.
Yeah. We should give a big round of applause to all the three panelists. They have been ingeniously, smart in making use of their time well, but giving a very sharp and clear perspective. I've been seeing lots of comments from the participants. They're very, very profusely appreciative of all the three of you for sharing. Very informative, they said, very insightful and thought-provoking kind of presentation. So well done to three of you. We have about 15 minutes now for some discussion. But before that, I have been going through the question answer box. There are about 4 or 5 questions that came, and mainly 3-4 of them have given. So before I say those questions and summarize, I think there is one young person who would like to share some reflections. I think it is Saran Prakash. Saran Prakash, can you put on your mic and speak and your camera?
Yes, sir. Thank you.
Yes, please.
Good evening, all the respected panelists. My name is D. Saran Prakash, and I hold a master's degree in disaster management from Tata Institute of Social Sciences, Mumbai. So the concern that I want to point out relates very, very closely to what Shivani Rana ma'am had just shared. Women and young girls in disasters has been a much debated cross-cutting theme of concern since a long time, and especially in the discipline of disaster management. And currently it appears ironically true that the novel coronavirus disease has become a breeding site for gender inequality that is threatening to relegate women to their gendered roles as caregivers. And all the panelists have rightly pointed out the dire need of ensuring adequate amount of water supply, especially for children in schools for different purposes. And additionally, there are some sections in our society wherein yet some, I would say, contextual measures are needed. For example, in many migrant and rural populations, women are possibly still continuing to fetch water from off-site water points or using community toilets. We can at the least only imagine that the waiting time at a water point or toilet site may make it extremely difficult or challenging to practice physical distancing, which is very important. So the concerns of WASH relate to surrounding physical factors also. Also, young women's access to safe menstrual hygiene management may be also first hindered, then limited owing to the disruptions in supply chain or stigma that prevents them from asking their male relatives to purchase sanitary napkins for them. And these are only just 2 of the several such challenges. So I understand that the linkage between COVID-19, gender, and WASH, as we must foresee, will exercise its impact on the future of many SDGs and related targets, and especially to SDG 10, which relates to reduced inequalities. But well, nevertheless, we need to take cognizance of the need that the road to recovery from here on must be based on an equitable and inclusive and gender sensitive approach where women and young girls also among other vulnerable groups are included in the COVID-19 response related discussions and planning with an emphasized focus right from grassroots level. And supporting such measures and activities, I understand the need for data is evident. Taking from what Shivani ma'am had mentioned, one recommendation that can be considered as an immediate step towards monitoring wash facilities for women is taking special help of ASHA workers who have been assigned the task of community outreach for awareness generation regarding precautionary measures of COVID to be taken. Since ASHA workers have wider spread and closer access for the purpose of surveys to identify symptoms of virus in the community, identifying challenges that women face not only through observation but also through community interaction can also be included, which can facilitate the needed data collection also. And especially because these ASHA workers also have prior experience of working in related matters. So basically, women need to be actively involved while keeping their roles, responsibilities, and also social norms in mind. This will be, I guess, the most important step in closing the gap between policy and practice. Because I must say, since the world has faced a collective yet differentiated impact of pandemic, the response too should be collective yet collective. That was what I had to say. Thank you so much.
Yeah, thank you so much, Sharon. That's a young voice. Again, inclusive approach, and we have at least 2 women speakers and 2 men speakers who have spoken about their views. Thank you very much, Sharon. And I have 5 minutes to 7 minutes for question answers. And there are 5 questions. I will put all the questions, and I would like to open it to 3 panelists to answer any of the questions they would like to answer. There's one question that says, what about preparation and transport hazard that students may be subjected to from their homes to their school premises and back? This is one question that came. Then there was another question that came, very decision of state governments in the wake of COVID. Is it better if the schools are open only after the vaccine is given to the students? Please comment on the preparedness of the parents and students about the decision of attending schools. There's another question which says, why can't an option be given to parents to opt for online real class since it's been practiced in countries like US? And then we have another point that is raised, when the very basic infrastructure is lacking in some schools, how is the government trying to start the schools without the vaccination process? Who has to bear the cost of providing necessary hand washing, etc.? And then there is another question that says, Ayush recommendation for immunity supplements to be distributed to children as a mode of midday meal scheme. The last one is about wash should not be pressed too much as it would lead to water wastage and derail the save water conservation initiatives. Should we not look for alternatives? So these are the 5 overarching questions that came. So we have 5 minutes. So we can ask each of the panelists, if you want to take a minute to pick up any point of the question and share your viewpoint. So shall I ask who is there ready to speak?
I can talk about, yeah, that's fine.
Yes.
Yeah. I'll take a question on the state decision. I would.
Yeah.
Well, I mean, the experts cannot say about what decisions need not be taken. Experts could definitely comment upon how they should be taken. I mean, from far, that's what we can comment upon. But the thing is, we cannot keep on waiting endlessly for the vaccination. Yes, indeed, the vaccination is necessary, but we cannot keep waiting for it. It's like waiting for Godot. There used to be a drama called Waiting for Godot. I don't know if anyone remembers, but why not think about the option that you could employ in doing the learning processes rather than waiting for a certain thing before you get students in the schools? I have a niece who is in standard 5th. Now, of course, I mean, she is not facing any hardships the way maybe it could be in the remotest areas of Telangana or maybe in Chhattisgarh or elsewhere. But even this young girl of 10 years tells me it's better to be in the school than to sit in a room at home and look at the screen. So the social sense of belonging that the students have with the schools. It could be retained, and the schools, I believe, they should be open with the appropriate care and precaution that if that is taken. And another point to it is that no infrastructure, no wash infrastructure could be built again to the Z economy. It needs to be done gradually. Incremental. If we plan for the incremental approaches, then we could definitely be able to mitigate the impact of COVID-19, I believe. Not sure if this answers, but this is what I feel.
Thank you, Prasad. You are always very wise in your responses. Very wise man. Thank you for that. So, would Shivani have any response to any of the questions? Would you like to comment on any point? Shivani, are you there?
Yes, Ray. I think maybe the very interesting question somebody has asked on the pressing needs of water, especially in this water conservation time. But I feel it's yeah, but still, we need to understand what is one is having a adequate quantity of water, and second is you're just wasting the water. So I completely understand a person's. And thank you for putting that question. I mean, it's all good to have the challenging question also in front of us. But I still feel that one is it is really important to see first that do you have adequate water or not? Because although water is scarcities right now, everybody is facing or people are going to face very soon in other parts of many parts of the country. But still, water is still required and still needed for maintaining a basic hygiene and sanitation and for drinking purpose. So that cannot be undermined. And we completely take this question, but yes, although we need to see that how best we can conserve water at home, how we can save water at home, just to keep a watch on the taps, not to waste water. I know we are using a lot of things these days, especially whenever I look at the AquaGuard in my home, I feel that's such a wastage of water. No, you are, although you need a safe drinking water, but we still can see that what are the best practices we can bring in use so that we can just stop wastage of water. But yes, adequate water is still is the need of the hour.
Thank you, Shivani. That's a very wise answer again. Yes, we need to save water. There's no doubt about it. We do waste a lot of water, and we need to recycle a lot of water initiatives. So these are very important. Thank you so much for that. Kanji, would you have any comments from your side, Mr. Khan Saab?
This is the question was that regarding the from home to school and back to the rather you can say home. There is one question. The school safety part, if you rather you can ask. See, all the state government, though the central government has given the direction guidelines, but in spite of that, the state government has taken its own direction and own guidelines that actually they will open the schools. That is one of the foremost point. Second point is that there is no doubt the school safety part is there and it will be also there. There is no doubt about that. When it starts from the home and it goes to the school and back to the home, all the facilities like the government schools as well as the private schools, they are taking more vigorously, undoubtedly. But at the same time, the parents are to be taken the much more care on these situations. So it depends upon how the parents are going to take the child in these COVID situations. They are more, but rather you can say, careness is coming on the parent side.
Excellent. Thank you. Thank you so much, Khan Saab. Three of you have given your sharp perspectives again. So we have the last 5 minutes to close this webinar, and I'm seeing lots of positive comments and appreciation from our audience. There are still 320 of them. So just to finally, close our session. In the first session, Prasad ji has highlighted about respiratory hygiene as a very important area, and how demonstration and behavior change are very important in this case. Then he has given us a very interesting, memorable model, which we see daily, traffic light model. I think it's a very good use of colors and, signals to human behavior. Then in all cases, vulnerability focus has become very strong, and crowd minimization is very, very important. And of course, Khanji I have always seen him as a one-person wash army. I've been working with him for many, many years, both in disaster times and normal times. And the kind of infrastructure development, some innovations he has brought, and also the last point about school Swachhata committee is a very important, small but important, structure that we need to look for. And of course, Shivani is a very passionate, young woman working in this sector. Herself has experienced so much vulnerabilities and has spoken from the heart in making it very integrative, making it very, very integrative, as well as of future focus and looking at an equitable approach to wash. So climate change again is a very important area, and one size does not fit all. That's a very important message. So let's take home all these unique reflections that have been shared by our three panelists, and many, many insightful questions from our participating delegates. So I would like to now hand it back to our NIDM colleague to finally close the today's webinar. And then of course action plan is something that we would like to have NIDMA support and lead further about the vitality of wash sector and how it's so important right from childhood to any age that we are, as long as we live on this planet Earth. And planet health depends on a very good wash, water, sanitation, hygiene. Okay, Ranjanji and Rakaji, over to you.
थैंक यू सर, आपने बहुत अच्छी तरह से पूरे 2 घंटे का जो वेबिनार था उसका क्रक्स जो है आपने बहुत अच्छी तरह से एक्सप्लेन किया. On the behalf of NIDM, my heartful thanks to all distinguished speaker and experts जो कि अपना बहुमूल्य समय निकालकर आज की इस वेबिनार में लोगों के बीच में अपना एक्सपीरियंस शेयरिंग किया. On the behalf of ED NIDM, I also very thankful to all participants जो कि जिन्होंने आज के इस वेबिनार को ज्वाइन किया है. And I also heartful thank to give all the technical staff of NIDM जिन्होंने हमें इस वेबिनार को आयोजित करने के लिए एक सपोर्ट दिया, जो टेक्निकल सपोर्ट दिया. मैं अपनी तरफ से हमारे जो एग्जीक्यूटिव डायरेक्टर जो है मनोज कुमार बिंदल जी को भी धन्यवाद देता हूं कि जिन्होंने इस तरह के वेबिनार को आयोजित करने के लिए हम लोगों को प्रोत्साहित किया है, और आगे भी इस तरह के वेबिनार को हम लोग करते रहेंगे. एंड खास करके स्पेशली मैं रेखा अंजनेला सर को हार्टफुल थैंक देता हूं कि जिनके मार्गदर्शन में और जिनके देख रेख में इस वेबिनार को आयोजित करने में मेरे को सहायता मिली, और आगे भी फ्यूचर में भी मैं उनके साथ इस तरह से कोलैबोरेटिव प्रोग्राम कराने के लिए NIDM के साथ मैं जुड़ा रहूंगा. और मेरा एक जो रेखा अंजनेला सर के साथ जो एक्सपीरियंस है लास्ट 10 ईयर्स से 15 ईयर्स से मैं उनके साथ जुड़ा हुआ हूँ. इसलिए once again sir, thank to you sir, and on the behalf of NIDM also thank to all participants and our staff also in Vijayawada regarding to this support. तो थैंक यू सर. तो अगर आज्ञा दे तो मैं आज के इस वेबिनार को यहीं पे समाप्त करता हूँ.
So much, and bye bye everyone. Thank you all our panelists. Have a nice evening. Yeah.
Thank you everyone. Thank you NIDM team. Thanks everybody. Thanks Ray. Thank you very much.
Yeah. Thank you.
Thanks very much. Thanks very much.
Thank you, sir. Thank you, sir. Thank you, Prasad, sir.
Thank you. Thanks NIDM, and thank you, Ray, as well. Thanks again.
Thank you, Khan, sir. And Shivani, thank you.
Thank you
for all.